HPV vaccine. There are 200 types of HPV viruses. The low risk HPV virus are responsible for warts. High risk HPV viruses cause cancers. They are responsible for certain percentage of cervical, anal, vulvar, vaginal, penile, and oropharyngeal cancers. How does this HPV vaccine work? Basically, this vaccine contains virus-like particles. These particles rearrange to look like virus, but they do not contain any DNA. Hence, whenever these virus-like particles are injected to the body, they cannot cause any infection, but body's immune system will recognize these virus-like particles as virus and will produce antibodies. So whenever body comes in contact with actual virus, these antibodies will go and kill the virus and prevent HPV infection. What are the HPV vaccines available in India? Basically, there are three vaccines available: Gardasil 4, Gardasil 9, and Cervavac. Cervavac is India's first indigenously developed HPV vaccine against cervical cancer. Gardasil 4 and Cervavac gives protection against four strains of HPV viruses, that are 6, 11, 16, and 18, whereas Gardasil 9 gives protection against additional 5 strains such as 31, 33, 45, 52, and 58. So, what is the recommended age for taking vaccine in India? The vaccine can begin as early as 9 years. If a child is taking vaccine before their 15th birthday, 2 doses are recommended 6 months apart. After 15th birthday, 3 doses, first dose and second dose after 1 month and third dose after 6 months of the first dose. So vaccine is given to the arm, an intramuscular injection. So as doctors, we recommend vaccine between 9 to 26 years. Gardasil 9 can be given up to 45 years of age. Beyond 26 years, the vaccine is recommended based on case-to-case basis. And the vaccine is most effective when given before exposure to HPV through sexual contact. That is, the vaccine is most effective when given before the onset of sexual activity. Are there any contraindications for HPV vaccine? Yes. If a person is having severe allergy to any component of HPV vaccine, they shouldn't be taking HPV vaccine. HPV vaccine is not recommended during pregnancy. Or if a person is having severe fever related illnesses, they shouldn't be taking the vaccine. And if the child is less than 9 years old, the vaccine shouldn't be given. Small minor infections such as cold are not contraindications for vaccine. So when there is no cold with no high grade fever, they can still go ahead and take vaccine. Can immunosuppressed individuals take vaccine? Yes, definitely immunosuppressed individuals can take vaccine. However, the efficacy might be less than immunocompetent persons. And in immunocompromised individuals, we recommend 3 doses. Does this vaccine have any adverse effects or side effects? No, there are no serious adverse effects reported with the vaccine. There can be mild pain, redness, swelling at the site of injection. Sometimes post vaccination, few individuals can develop a giddiness and they can faint. Hence, we recommend the individual to be seated at least 15 minutes for 15 minutes after vaccination. Rarely, some people can develop headache, nausea, vomiting, fatigue, and weakness. How efficacious is the vaccine? If the vaccine is given before the onset of sexual activity, it can prevent 97% of pre-invasive diseases of cervix, vagina, and vulva. But you have to remember this vaccine do not protect against all HPV subtypes. This gives protection only against certain strains. Hence, vaccinated women need to continue to receive cervical cancer screening with pap smear or HPV DNA. So after vaccination, almost 93% of the females and 99% of the males developed antibodies against HPV virus. So prevention against cervical cancer is just the tip of iceberg, it also gives prevention against cervical precancers and all other cancers caused by HPV virus. So when it comes to efficacy, it helps to prevent roughly around 90% of cervical cancers, 90% of genital warts, and roughly around 90% of anal cancers. Thank you.